Good morning, everyone. Scott Maybor here with your Medicare Missive from the pond for Tuesday, the 21st of July. Hope you are doing well. So later on today, I have an appointment with a new client. Haven't actually spoken to her. We've exchanged some emails. So I don't know all the particulars. I know she's 71. I know that her A and B are active, so she's been paying for B. But she's also on her husband's insurance, and she sent me her Anthem Blue Cross card this morning. So one, if the company her husband works for is fewer than 20 employees, then she should be paying for her Part B. Part B is going to be primary. If the company her husband works for is over 20, she should either be paying for Part B or she should be paying for the Anthem Blue Cross. There's no need to have both. I don't know the circumstances. I know that the plan is changing and it's becoming much more expensive. I don't know if the company was sold or he has a new job, but her health insurance is changing and it's much more expensive to insure her. One, it already seems like she's been double paying. I don't know that for a fact, but that's what it seems like. And this is her Anthem card. And I just wanted to point out a couple things. So when you're on Medicare, A is free for most people. You've paid, if you have 40 quarters in, you've paid into it, so you're not paying a premium. If you have less than 40 quarters or you don't have them through a spouse, then you may pay a premium for Part A. Part B, you're paying approximately $203 a month, $204 a month. And that is income adjusted. Then you can either be on an Advantage plan and pay 0 to something, depending on your Advantage plan. Typically, they're at the lower end on the ones I recommend, so 0 to 60 per month is a premium. You could be on a Medigap plan, which ballpark somewhere between $200 to $250 a month. Potentially a drug plan, definitely a drug plan if you're going with a Medigap. But a couple things to keep in mind. So I don't know what she's paying monthly for this to be on this plan. It is a PPO from Anthem. Her office visit copay in network is 20%. So if the doctor's office visit is a couple $100, it's $40. That's after the copay. After the deductible. This sheet does not. Oh, it does give me the deductible. $3,400. So the way that's going to work is the first $3,400 is out of her pocket. She has no medical coverage until she hits $3,400, except for preventative. Prior to or after she hits the $3,400, she's paying 20% of a doctor's office visit. That's an in-office visit, in-network office visit, 20%. Same for a specialist. So first $3,400 is out of pocket. Then she pays 20%. If she had a Medicare Advantage plan, most PCP visits at this point are free or $5. A specialist visits 45 or 50, and people like, oh my God, 45 or 50. This is 20%. 20% of what? I bet a specialist office visit's several $100. You go and see a cardiologist for 10 minutes. I'm sure it's $400, $500, $600. You're paying 20% of that after you've met your deductible. An Advantage plan, you're going to pay usually 0 or 5 for primary, around $45, $50 for a specialist. No deductible on most plans. So you have immediate coverage. If you have a supplement or Medigap plan, you pay 0 after you meet your deductible, but the deductible is $300 instead of $3,400. This also has a max out of pocket of $7,000. I tell people all the time, this is the max out of pocket on this particular Advantage plan, and it's usually somewhere in the $5,000, $6,000, $7,000 range. Could vary between in and out of network. But right in line with this Blue Cross corporate plan. If you have a Medigap plan, your out-of-pocket maximum is $300. Once you meet the $300, you have nothing. So for $250 a month, round number, you pay $300 up front. That's your deductible. No copays, and there's no network. This plan, I don't know how much she's paying a month to be on the plan. It's her husband's plan, so she's the plus one. It has a $3,400 deductible before the plan kicks in. Then it has a 20% copay for office visits. Then it stops at $7,000. That's compared to a Medigap plan. If she goes with an Advantage plan, which is what she indicated she wants, she's going to have little or no premium. She's going to have a fixed copay for in-network visits. Could be as little as $0 for a PCP, usually $45.50 for a specialist, but no premium on that. No deductible on that, as opposed to a $3,400 deductible, and the $7,000 max out of pocket, right in line with what the Advantage plan is going to be. So when you're eligible for Medicare, don't simply dismiss it because you think the corporate plan is better. I can guarantee you in almost all cases, it is not. And I don't even know what she's paying, but take $3,400, divide that by 12 and add that to the premium, because you don't have insurance till you hit $3,400, so you might as well just call that premium. Make sure you're doing the math correctly. Make sure you're weighing the pros and cons. This is a PPO, but they're talking about in and out of network charges, so out of network is going to be harder. They're not on the card. You could buy a Medicare plan with no copays, a $300 annual deductible, and no network. See any doctor you want. So be careful when you're comparing plans. It's more than simply the premium. I suspect that for the past 6 years or so, this woman should have been on Medicare and would have been far better off. Let me know if you have any questions or comments. Thanks for watching. Like and share. I appreciate it. Have a great day, everyone.